As you know, the United States, as I said, just surpassed 10 million cases of the virus. We keep breaking the record for most cases in a single day. On Saturday alone, it was nearly 130,000 cases just here in the U.S. Did you ever think, Dr. Fauci, we'd be in this awful position where it seems to be getting worse?
Well, unfortunately, we predicted it, Wolf, when we were talking about the fact that as we enter into the coolest season of the fall and the upcoming colder season of the winter, that you're going to start seeing more indoor activity. And we never got down to a good baseline. As you know, you and I have discussed this multiple times, when the baseline of infections, which hung around 20,000, then went up to 40, and then 70, and then down to 40,000 again. And now, as you see, we're well over 100,000, and that is really something that is unfortunate. I had said 4 months ago at a Senate hearing that if we didn't get control of this, that would be conceivable that we would reach that level, and unfortunately, we have. Having said that, it is not too late to turn that around, Wolf. It's a serious situation, as you mentioned. You can't run away from the data. It's real. But we can turn it around. And in addition to that, as you mentioned a little bit ago, help is on the way with a vaccine. We need to hang on, double down, do the kind of public health issues that we spoke about, the washing of hands, the wearing of masks, the physical distancing, the avoiding crowds, the doing things outdoors preferentially over indoors. And we can blunt these surges that we're seeing. It's possible to do, and we will be able to do it. We just need to do it, put the effort in, and just hang in there, because a vaccine that we'll talk about in a moment is something that is really quite promising now, and it's right around the corner.
Yeah, you're absolutely right, but you need national leadership to do that. It's so rare, Dr. Fauci, that we do get potentially any good news at all about the pandemic. Let's talk about this Pfizer announcement that its vaccine is more than 90% effective. That soars past the standard the FDA was looking for of at least 50% efficacy. So just how big of a deal potentially is this news?
You know, it's extraordinary, Wolf. It is really a big deal. Now, obviously, we need to go over the details of the data, but this is a highly reputable company that has extensive experience in the development of countermeasures, including vaccines. And the Data and Safety Monitoring Board, which is the independent board that I've spoken to you about often, that independently looks at the data, has come up and told us that we now have a vaccine that is more than 90% effective. So the process now is to go over in great detail. There's still some questions about the durability of the effect, about how effective it is in the elderly versus younger people. But the bottom line is, as a vaccine, it's more than 90% effective, which is extraordinary and will play a major role in what the outcome of this is going to be. That's the immediate good news. The other good news, Wolf, that's important is that the type of vaccine that it is, an mRNA vaccine that I've discussed with you in the past, that is not the only company that has it. There's another company, Moderna, which has a vaccine very similar, if not identical to this. Their results will be coming out soon. So it's likely that we're going to have more than one vaccine that's effective. And the particular protein that was used, the spike protein of this particular virus, was the object, as it were, of the immune response, what we gave to people to induce that immune response. The fact that that worked with this vaccine harbors very well for future vaccines against COVID. So the news is really good all the way around. This is something that we should really feel good about. But I want to make sure people understand is that it's good because we know there's light at the end of the tunnel, but that doesn't mean that we're going to give up the important public health measures that we continually still have to do every single day.
Even if the vaccine, Dr. Fauci, does get approved, it needs to be, we're told, stored at an extremely low temperature. People need to take 2 doses within, 4 weeks or so apart. What are the biggest challenges to actually getting enough people vaccinated so that all of us can return to normal life?
Well, there are challenges there. There are logistic challenges, supply chain challenges. We have a very important effort that's been assigned specifically to that. Part of that Operation Warp Speed, there's the scientific aspect of it, which is led by Moncef Slaoui. And then there's the logistic aspect that's led by General Gus Perna. And he has been working full time to make sure that the logistics of getting this distribution will go smoothly. Now, right now, we know that what the company will do, very likely, in fact, I'm certain they'll be doing it, is putting in soon, within the next week and a half or so, for an emergency use authorization and ultimately for ultimate approval of the vaccine, which means if that goes along smoothly, that we may have doses that we're able to give to people by the end of November, the beginning of December, probably well into December. Now, again, you have to go through the hoops of making sure all the I's are dotted and the T's are crossed about the safety and the regulatory aspects of it. But we would be giving vaccine to people very likely before the end of this year. That is good news.
That's great news. We're all hoping it works out. As you heard today, I assume you heard, the president-elect Joe Biden, he outlined his pandemic plan today in great detail, including ramping up testing, hiring more contact tracers, providing clear guidelines to businesses and schools, addressing racial disparities, scaling up treatments and vaccines. So what do you make of the approach that he laid out?
No, I mean, it's an approach that we're all trying to do. We really do want to make sure that we get more testing. That's obvious. I've been talking about testing for a very long time, and we now have a lot of testing we can do. We have antigen testing, which is what, Debbie Birx and I have been talking about getting much more screening in the community for asymptomatic infection. That is really important because right now what is driving the outbreak in the sense of essentially people coming in the home, small groups of people, 8, 10 people meeting together with friends for a dinner, not knowing that one of them is infected. Once you get enough testing out there in the community, you'll be able to get those people identified and get them out of circulation for the time being so they don't infect others. So these are all things that we all agree with.
You know the president-elect when he was vice president for 8 years. You worked with him. Have you spoken with Joe Biden since he became president-elect?
Everybody asked the questions about that, Wolf. I would prefer not to talk about any of that because right now I want to focus on what I'm doing now with regard to getting a vaccine and getting this country well in the sense of towards normality, which I think we're going to be able to get there with this vaccine.
But
that's what I really want to talk about.
Can we assume, Dr. Fauci, you're going to stay in your current role at NIH? You'll stay in the government, at least for the time being?
Certainly, that's what I want to do, and I believe I will be doing that.
And presumably you'll stay in after January 20th when the former vice president is inaugurated.
I have no intention of leaving. This is an important job. I've been doing it now for a very long time. I've been doing it under 6 presidents. It's an important job, and my goal is to serve the American public no matter what the administration is.
Yeah, and we hope you stay on the job because no one does it better, and you've done incredibly important work for the American people. I'm just curious, when was the last time you actually spoke with President Trump?
I spoke with him during the time that he was in Walter Reed when he was ill with COVID-19. We had a conversation during that time.
That was at these meetings, these coronavirus task force meetings. I guess they go on, but not much is going on. Let me ask you about the team that the president-elect is putting together. As you know all these people. I know him as well, the former Surgeon General during the Obama administration, Dr. Vivek Murthy, the former FDA Commissioner David Kessler, the former vaccine official Dr. Rick Bright, among others. What do the choices tell you about how the incoming administration is going to approach this continuing crisis? Even if there's a vaccine, it's going to be with us, sadly, for a while.
Well, they're all established individuals. I mean, obviously, you could not possibly be in the business that I and my colleagues are in without knowing each other. These are people that have been involved in this for years and years. Of course, I know them. I know them well. I mean, anyone who's in the field knows them. That's not a surprise.
But you admire them. You think they're qualified and all that, right? So,
yeah.
Yeah.
They're of course. They're colleagues of mine. They're people that I've been dealing with for years and years. Of course, they're qualified. They're qualified colleagues.
All right, that's great. We're really grateful to you once again, Dr. Fauci. Stay safe out there, and and we'll stay in very close touch with you. We appreciate, once again, everything you've done for the American people. Thanks for joining us here today.